Oh, we're going to have fun today. You know, there are many underutilized tools. The model spine is an underutilized tool. The spine models are probably underutilized. There's tools we have available that we probably don't use enough for patient education. And the granddaddy of probably all of them, because it's so credible. See, the model spine is just a model spine. Fine. Posters are just posters. See, anybody can kind of make a poster the way they want to make it. So possibly the most credible tool that you can use to validate chiropractic, to validate and support what you are promoting, what you are teaching, what you are trying to get across as the reason why you want to give adjustments, why they should continue care, how chiropractic works, why it works the way it does, is the anatomy book. This is unarguable. It is just anatomy. In fact, chiropractic is just anatomy. Just anatomy in action. That's all it is. I don't believe in chiropractic. There's nothing to believe in. It's just anatomy. Nerves go from here to there, and if they get dinged up, something doesn't get through or doesn't get back to the source where it needs to get to. So we have the anatomy book, okay? I want to go on and on and on about how powerful this is, but it is credible because it's the anatomy book. Now you see here, I have a bunch of pages marked. I had to throw away all of my other Post-it notes I was using because they were so worn down you couldn't even see them anymore. By the way, just look at the condition of my book here. I mean, it's falling apart. I have taken this thing all over the country. Okay. In fact, I might even just show a quick picture here if I can find one just for fun. Never going to dig into this. I'll show you how to use this for maximum awesomeness. Maybe I don't have that picture in here. Maybe I do. We'll see. I've had this at places. Oh, here it is right here. Unbelievable. Here I am in Las Vegas at one of the most popular UFC gyms in the world. And there I am with my Netter anatomy book, showing it to this gal ended up becoming a world champion. Of course, you see the cage there. There's an octagon mat in the background. And there I am with my anatomy book explaining chiropractic. You see my portable table is right here. And because of the credibility of myself and the anatomy book, I'm able to get the people adjusted. Okay? Back over here. So we have this. Now I'm going to go through the pages I have marked. Now this sits right by the adjusting table on a shelf. Okay? It's on a shelf with some other smart looking books, and usually we get a couple big heavy bookends. Okay? And so this is up there right where it belongs, where I can grab it and have it handy. Okay? Yes, we can have copies of these pages laminated in other areas in the office with our ammo. And we can even have copies that we can give out to people and write on and circle things, okay? And you'll see which ones those are as we go along here. So let me make sure I'm staying with my notes. Yes. Oh, here's the key point. Oh. People don't know anything about anatomy. They just know there's a body and there's like a heart in there and a stomach, and that's it. There's lungs somewhere. That's all they know. They don't know anything. They know that there's a spine and there's a spinal cord. They just know a few terms, but they can't picture and they don't know what it means, and they don't know how anything works. They do not know that there is power running the body. Okay? All right, they can't describe it. They might have some awareness that it's there, but you get my point. They don't know any anatomy. So here's the ones I have marked. Here's one of the very first ones right here. This one right here. Why? Because that's where I say the nerves come out of the neck and go up to the head and cause headaches. See, you see the nerves going up the back of the head here, coming out of the neck. So neck problem, up the back of the head. Neck problem, up in front of the ear. Okay, so this is where I tie in headaches like this here with the neck. So I can go to my neck adjustments, okay, and they understand. Okay, right there. Okay. Next one. Oh, I have used this a million times. All the nerves coming out the neck. Okay. Also, this is where I show that the nerves go directly into the blood vessels and control the expansion and contraction of the carotid arteries supplying blood to the brain. So, spinal adjustments in the neck, positive effect on carotid arteries and circulation to the brain for thinking, cognition, intelligence, and headaches. Very, very important one to show. I also have used this many times, and it has saved me many times. This is where I show this blood vessel can get pinched in between these muscles, okay? In between these scalenes. And it can get squished in between those muscles and cause numbness or tingling down into the arm. So it's not a circulation, it's a circulation problem, not a nerve problem into the arm. You got to be able to distinguish between a nerve problem and, like, you know, if you cross your legs and your leg goes numb, that's a cut off circulation problem. It's not a nerve problem into your leg. Usually, you get the idea. So I'm using this to show that, all right? And the complexity of all of these nerves in through here, okay? Very, very important plate to have marked. You'll use it all the time, okay? All right. Ugh. I have shown this one a million times. People will say, hey, I've got these bumps in my neck. Or what are these bumps? I've got these bumps now. And you show that they are swollen lymph nodes. People do not know that blood goes out and only 99% comes back through the veins. The other 1% of fluid is working through the cells and cleaning up gook and draining back through the lymph vessels. And if they're really working hard cleaning up stuff, they will fill up the lymph nodes as they slowly drain and then get filtered out in the system. So here they are, okay? And this is where I show back here. Oh, you see right there? Or along the front? Oh, my glands are swollen, I'm sick. Well, of course, it's not their glands. They're swollen lymph nodes. It means the body is cleaning something out and draining it. It is a good sign, okay? It means your body has attacked it, cleaned it up, and it's getting it out of there. This is why you drink a bunch of water, to keep it in your system circulating through so you can filter and pee things out, okay? Very important, all right? So you use this one all the time. What are these little bumps? What's going on? I'm sick. Explain that system, okay? Next, very common, because people don't know how the ear works, especially if you're seeing any kids. It's very important they understand that, see how narrow this is? This is where, if the neck is twisted, like if you twist an ankle, it swells up. If you get the neck twisted at birth, it swells up and it pinches this off. And the fluid accumulates here, okay? And when you have a dumpster full of garbage, it's only a matter of time before you have rats. Clean out the garbage, no rats. If fluid is allowed to accumulate in the middle ear, okay, then bacteria will be allowed to grow. If it's able to drain and stay clear, no place for bacteria to grow. We must make our neck adjustments to keep this, okay, as open and flowing as we can. There is not a person really with any intelligence that, if you use this picture out of the anatomy book, would not understand why every kid should go to the chiropractor with ear infections. Okay, but if you just talk about it, well, chiropractors can help with ear infections, that doesn't make any sense. That makes sense, because as soon as they see how narrow that is, as soon as they see that this is where it gets pulled up and nasty, this is also why you explain how you do the ear ossicle adjustment, reaching in with the thumb here, okay, tractioning, all right, out, and it pulls on the eardrum and goes kapop, and it pops and literally makes an adjustment to the ear ossicles, okay, which can release pressure that's built up in that middle ear. That move has like saved people's lives, because if this is blocked and it cannot equalize the pressure, we can equalize it through the ear ossicle move. You got to be very gentle with this, especially with kids, very gentle. Because if this is hot and irritated and you yank on their ear, they'll never let you near them again. So you got to sneak up on them or have a parent do it. Okay, you just tell the parent to do it. Okay, put your thumb here and just pull out and up. Okay, click. Okay, very important. I can't even stress how important that is. Okay, now by the way, nobody ever showed me this. Nobody taught me this. This is just like my own common sense. Okay. Oh, I use this one all the time, because this is the one that shows that the spinal cord ends way up here at T12, but yet the nerves can come down and out and people feel the pain here, but the pressure, okay, is up here. This is why for you to get good lumbar results, you have to be attacking T12, because that's where all the nerves come from. It's wider there. The spinal canal is narrower there. It's a transitional area. It's the most common vertebra to subluxate because everybody blows it out the back. I mean, T12 is it. L5, C7, T12. That's it. If I could only do those for the rest of my life, that's what I would do. Okay. Oh, the atlas, the atlas. I don't know. If I could only get one adjustment for the rest of my life, it would be T12 way before the atlas. Again, any vertebra can make your life miserable. And whatever vertebra is jacked up is the one that needs to be adjusted, I know. Okay, but there's nothing like the feeling of getting a T12 adjusted on a knee chest table. Boom, you stand taller, you feel electrified. It may be one of the best feeling, immediate, energized sensation adjustments that there is. In fact, it probably is that, just that, okay? L5, T12, C7, some upper cervical work, okay, occasionally, right, you might say. All right, then of course over here, all right, showing where the nerves go. People don't know that. People don't know if their foot is numb on the top, that it's coming back, okay, to the spine. Okay, it's very important that they understand that, okay? They don't know that a problem with the foot is caused, okay, by the spine. They don't know, they cannot make that, I got a foot problem. No, you have a spinal problem, but you feel it in your foot. You have to have those dermatome diagrams to show. Oh, I've shown this a million times. Notice right here, right out of the spinal cord comes a nerve. Okay, actually, on this side it shows, and that nerve goes back to the surface of the skin, along with its corresponding blood vessel. That is why, if there is pressure in here, this nerve will be irritated, and it'll be tender there. There'll be little swelling, and it'll be sort of pitting there when you push on it. Okay, it'll blanch. You push, you'll run your finger through it, and it'll get red underneath there. Okay, the easiest way to determine if there's a problem with the vertebra is to just really dig and push sideways on the spinous. Okay, healthy vertebra and healthy spines don't hurt. I want you to really think about that. If you went down my spine right now, there would be a lot, ow, 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 there'd be a lot that would hurt. Okay, because of the shape of my spine, the buckling that's occurred in there, me sitting all the time. Okay, now some people have high pain tolerance, and some people, when you push, the pain signal doesn't get to their brain. It could be that bad. Okay, you have to understand. Now, by the way, if I'm going to be using a nervoscope, as an exam tool, which I do like to do, okay, this is what shows me, well, it's picking up the heat on these nerves and blood vessels right on the surface of the skin. Also, this is where I show if someone has pain in the front, this is where I tell them the nerve comes out and it goes all the way around to the front. Okay, I got this pain coming around. I know it's following the rib all the way back to the vertebra, and that's where we need to make the adjustments, okay? And of course, here I love this. Once again, shows how the nerves come out, and I'm sensing the heat and any irritation along that path, okay? In fact, when we do a spinal exam, we're basically examining, okay, any of the nerves or blood vessels that may be irritated along the spinal system, the spinal cord system, the vertebra system. Next. Okay, this is one I'll have. I won't spend a ton of time on this, but watch. Just so people understand, look at all the nerves that go to the heart. Look at all those yellow nerves, okay? The nerves that are running everything, coming out of the neck and, of course, the spinal cord. Now, here's where I will show, okay, over here. Here's the vertebra that power the heart. That alone, knowing heart disease is the leading cause of death, every adult should go to the chiropractor every week or 2 or 3 just to get T1 to T4 adjusted to stimulate the nerves to the heart. And I'm not telling you that. That's what I'm saying to people all the time, okay? Here's another even closer diagram of the nerves coming back to the surface of the skin and the ones that wrap around to the front, okay? Or I've got this pain, it comes around, it's really tender in here. Yeah, I know. Okay, there it is right there, wrapping around from the spine. People don't know that nerves wrap around. You got to get them to see their problem and trace it back to the spine. You have instant credibility and validity and power and authority now because the book does not lie. Okay. You want to see pregnant moms? You should have this laminated everywhere. All the neurological power required to the developing baby. Unbelievable. Okay? Versus, well, you really need to get, full power. It doesn't mean anything. Show a picture. Oh, I've shown this at least 1 million times. The nerves coming out of the neck that power the arms and wrap around to the chest. And there again, right there. And I always say, you see here when we were examining your spine, okay, the vertebra, okay, number 7 and T1, okay? And many times I'll have this, and I'll show it right when I'm showing their x-ray, or I'll make a couple quick copies of this to give to them and circle it as they leave that first day, okay? Of course, you have to have the ones marked where the nerves go into their fingers because they'll say, boy, my fingertips are numb. And you have to be able to say, oh, yeah, you mean like that right there? Instant belief, instant credibility. God, it's on my pinky. Oh, you mean like that right there? And then what you do is you sit there, okay, and you'll say ulnar nerve, cervical number 7, 8, and the first one in the upper back. That's exactly where we're working on it, Bill. Okay? Otherwise, they think they got a hand problem. See that? As soon as you show it, wow, that's me. You identified with me. That's my problem. You understand it. I now trust you fully. Okay? Oh, I've shown this 1 million times. How complex all the nerves are coming out of the lumbar, and of course, how these muscles here hook that allow us to walk. They connect from the spine to the leg, and they allow the leg to move forward. This is why okay, you should go for a walk after you get adjusted. Okay, versus this is why you want to go for a walk, because when you walk, okay, and the leg is moving forward, okay, it actually moves the vertebra and improves the circulation because it's moving the spine as you walk, because the muscles that allow you to walk actually, they think their leg muscles make them walk. They don't realize that to move a leg forward, to kick a soccer ball or kick a field goal, those muscles are connecting to the spine directly. Nobody knows that. You got to show them that. People love to learn. The next one I have marked, well, obviously, okay, anything going down the back of the leg, okay, all right. And then of course anything with the dermatomes into the leg like so. All right. Boy, the top of my foot is kind of numb. I know. Okay, there it is right there. But notice it goes up, and what vertebra does it say it is there, Bill? L5. Yes. Where's L5 again? What's the bottom one in the low back? Okay. Are you getting the idea? This is so obvious that it's important. And again, everything I'm teaching here is to build, I mean, a massive, powerful, huge influence office that has incredible demand, so the fees for the services can elevate, so that your collections can be maximized. Okay, see, the more people understand about what you do, the more they elevate what you do, and the more they will pay for what you do. If they don't know anything about what you do, how can they pay anything for it? It's purely, I go in and it kind of feels better. Can you see how each one of these could be a video on your website? Here's our anatomy lesson for the day, everybody in social media land. Here we are with our Netter Anatomy book, the authoritative source for all medical, dental, chiropractic, and osteopathic colleges worldwide. Okay, bing, and here it is. You know what I mean? Right? Okay, here it is right there. Unlimited information to use for posts, to make videos with, to have on a website, to of course have handy in the office, to make copies of and laminate to have around the office, positions where you might need it, to have copies made in regular papers you can take and give them to the patient along with a picture of their x-rays, along with spine charts and whatever else you want to have marked and highlighted for them. See, the more you can get people to understand and the more you can use authoritative sources like this, the more they believe in you, the more they trust you, the more they refer to you, and the more they want to pay for what you do. I think you're getting the idea. Okay, there it is. Tory, can you send me all? No, just go through your book, follow the video, and mark all the ones you think are important. Okay, make copies of them, laminate the ones you want, make copies of other ones, have them in your hanging file folders ready to go. Okay, all right. Patients love to learn. CAs love to learn. By the way, it would be smart to sit with CAs on each side and go, okay, it's storybook, it's story time with the anatomy book, or anatomy book story time, okay? And say, let's go through here, and this is why this, they don't know. Oh, they work at a chiropractic office now, they somehow magically know why kids should go for ear infections. How would they know? They only know what you have sat down and educated them on. That's all they could possibly know. And you want them to be out there, okay, against all of these anti-chiropractor people, or people who don't know anything. You got to arm them with information. And when they know stuff, and you can just sit there and say, nobody knows this. You'll go out there, you will know things that they don't know, okay? So you have to be nice to them, and you have to feel bad for them, because they'll argue, but they don't know what you know. It's a very important statement. They don't know what you know. Okay, all right, and you go through all of this and you have some fun, and this is why this is and that's why that is. Okay, all right. You can build a huge practice with a model spine and the anatomy book and a copy machine and some care and love. Care and love enough to want to educate people, and it's moments. You see how quick that is? Well, Bill, here's what's going on. You see how that goes around the inside like that? That's why we're working on your neck, exactly like I've been doing here for the last few weeks. See that? It's seconds. It's fast. What if I just pull it up on a computer? By the time you bumble with the keyboard, I've already gone like this. I've already shown them. Okay, you see here it wraps right around and goes into your foot. That's why we're working on that L5. You get the idea? It's got speed, and everything at Winner's Edge has to have speed, or it is immediately jettisoned from anything we can do, because speed is everything. Speed, impact, educational value, credibility, validity, understanding, all of that stuff, okay? And I just want to keep going on this because it's so important, okay? As I go and do office visits around this fine country, I hardly ever see an anatomy book. And you have what you have is you have chiropractors that are making it on personality, and there's some systems, and that will get you to a certain point. But I'm talking to get to the big levels, okay, like where you're way over 100,000 a month all the time, not like you had a little special thing and you kind of blipped up there for a second. No, I'm talking about being way over all the time, automatically, big demand, big collection per visit, lots of credibility, lots of power, lawyers respect you. I mean, just the powerhouse DC, okay? It's going to take more than personality, incorporating some systems and doing some stuff your way. It's going to take everything in place and all of the tools and ammo so you can build a huge, huge, huge tribe of people that understand and they trust you because they know you are the expert. There you go.